nearly 60% of patients that go to hospital require peripheral cannulas or drips. But despite their commonality, the failure rates from these devices are quite high. For example, these devices will cause the vein to inflame. They cause swelling because the actual cannula goes through the vein into the surrounding tissue where you get all that fluid and medication. So from a failure perspective, it's a huge issue. If it was any other product, it'd be recalled. So the first step really was to go to the clinical coalface. Let's see how these devices are managed. So what we asked clinicians to do was to walk around the hospital and review patients that had a peripheral cannula in place, and then they undertook a clinical assessment. So they looked at where it was actually placed, the size of the device, the type of dressing that was on, whether that dressing was clean and intact, were there any clinical signs of inflammation of the blood vessel, and we know that that is a precursor to failure. Now what we found was that if you go to any hospital around the world, on average 1 in 10 patients will have an inflamed blood vessel from a peripheral cannula. So we're talking hundreds of millions of patients around the world. We also found, for example, that nearly 15% of patients had cannulas in, but there was no clinical reason for it to be in, apart from just in case. Now we know that in hospitals, any type of plastic that penetrates the patient's skin are a risk for infection. What we now need to do is to look at these results and see what we can do to fix these problems.